Okay, so welcome everyone. Now we are going to look at some most important questions of pathology. And the question is: a 20-year-old male is present with weakness of all four limbs. For 2 days, motor system examination reveals tone is decreased, power is 3 by 5, absent reflexes in upper and lower limbs. So, what can be the diagnosis? Now, the patient has weakness of all four limbs with decreased power and reflexes of both of extremities. Now what can be diagnosis? Now the four limb power decrease with power and decreased reflexes indicated of GB syndrome, Guillain-Barré syndrome, and there is investigation LP, EMG, and stool culture with serology is performed. And management, in management we will hydrate the patient, give IV immunoglobulins, and plasma exchange within 14 days. We will perform plasma exchange within 40 days, so 14 days. So in this way we can manage the patient of GB syndrome. Okay, so another question is the patient is 17-year-old and presented with breathlessness, abdominal pain, vomiting, and random blood sugar is 345. Now we have to look at this, that the RBS, random blood sugar, normally presented with less than 120. So in this scenario there is 345 random blood sugar. That means diabetic ketoacidosis, because breathlessness and abdominal pain in patient is age of 17 years. So DK most commonly occurs in young patients, diabetic ketoacidosis because of type 1 diabetes mellitus. So what will be investigations and management steps? Now the diagnosis DKA and investigations will be urine serum ketone bodies, serum electrolytes, and ABGs. And steps of management will be IV insulin, fluid replacement, potassium replacement, and antibiotics should be given. And the diagnosis is diabetic ketoacidosis. Now investigation is urine serum ketone bodies. We look at the urine serum ketone bodies, and we have to monitor the random blood sugar after every 1 hour, and electrolyte maintenance should be done, and ABGs are also done to look at the electrolyte status of the patient. And another question is, what are finding in this X-ray? And X-ray shows homogeneous opacity of left side of lung with loss of costo and chondrophrenic angle. And the diagnosis, differential diagnosis can be pleural effusion, Marslian, or empyema. Investigation is pleural tape for DR or gram stain. Blood culture and pleural tape is also performed in order to diagnose this. Okay, so this question is most important question, and its presentation are more important. 30-year-old male patient present with fever of 103 Fahrenheit, chills and fever associated with copious rusty sputum, and complain of pain in left hemithorax. And examination reveals bronchial breath with vocal resonance on the left middle posterior chest. What is diagnosis and management plan? So diagnosis is community acquired pneumonia, and investigation is blood culture, sputum culture with chest X-ray. Now community acquired pneumonia treatment should be oxygen, IV fluids, antibiotics like amoxicillin and ceftriaxone, and NSAIDs for pleuritic pain should be given. So this is diagnostic treatment for community acquired pneumonia. We will also look at in depth about pneumonia and its types and treatment also. Okay, so there are two types of pneumonia most commonly, and first one is uh, community acquired pneumonia, and another is hospital acquired pneumonia. Now community acquired pneumonia is a pneumonia which occurs in community and occurs in before 48 hours of hospitalization. Most commonly type of pneumonia. Hospital acquired pneumonia occurs after 48 hours or more during hospital stay for another illness, and there are high risk of mechanical ventilation associated pneumonia, VAP. So these are two types of pneumonia: community acquired pneumonia, which occurs before hospitalization, 48 hours before hospitalization, while hospital acquired pneumonia occurs after 48 hours of hospitalization and stay in hospital.